Forgetting stuff happens all the time, but my auntie seems to be forgetting everything, and it's getting worse. I've heard about dementia, but who is at high risk of getting it and why?
Dementia is an age-related condition, so as you get older you have a higher risk, and particularly people over 65 years of age. So most of our Aboriginal and Torres Strait Islander people don't really reach 65 at the moment, but those that do are at risk. As well as that, we have these risk factors, so they're the things that can help lead to dementia later in life, such as type 2 diabetes, which lots of our people have, high blood pressure, which lots of our people have, smoking, which we smoke at about 2 times the rate of the rest of the population, previous history of alcohol, high levels of alcohol, brain injuries, and a number of other things, including not a lot of early education. So all of those things are kind of a lot of what we already have in our community. So so we've been finding that there is a bit more dementia in our communities than what we thought before, and it may be more prevalent than the rest of the communities. Look, I think the main thing for anybody that you're worried about is to get them checked out. And look, the easiest way to go about that is to first of all just go and see a GP. If you've got an Aboriginal medical service close by, that's the best option for you usually, because they can understand the cultural issues as well, and if there's language barriers, which is a big problem in the assessment, then that can be assessed properly, and then you can have an Aboriginal health worker or a liaison worker with you as well to help you out with some of those questions. So the best thing to do is get that initial screening done, because we might not know what it is. It might be depression, it might be a stroke, it might be something else that's happening that's causing, your uncle or your granddad or whoever it is to lose their kind of memory a bit and to be a bit disorientated. So the important thing is to first find out what exactly is going on.
My mum's been diagnosed with dementia. I'm really scared I'm going to get it. What are the early warning signs I should look out for?
In Alzheimer's disease, the commonest presenting symptom is memory loss. People are not able to function normally because they can't remember what they should be doing or what they've just done. And it's short-term memory loss. So you might be able to remember very accurately what you did 20 years ago, but you can't remember what you had for breakfast this morning. And if other people notice your memory problems, that is also a concern. In vascular dementia, often they have problems with speech, sometimes with behaviour, sometimes with calculation. In dementia with Lewy bodies, visual hallucinations, vivid visual hallucinations are often quite common, and people can get quite stiff and look as if they have Parkinson's disease. In frontotemporal dementia, often it's behavioural changes. People start making really odd decisions about their life, about their money, and this can be the first sign of frontotemporal dementia. If you notice any problems with memory in yourself or in someone close to you, then it's really important you go and talk to your general practitioner. Explain your concerns and ask him or her if they can examine you for that, because there are things that can be done.
I know my grandmother had it before she passed away. Am I at risk?
There is a slightly increased risk of getting dementia if a member of your family has it, but it's not huge. It's actually about 3%. So just because a family member has it doesn't mean you'll get it unless they got it when they were very young. If a person with dementia is in their 40s or 50s, then you need to look for a family history of dementia, because there could be an underlying genetic problem there.
It was a shock to both of us, and now the deterioration just seems inevitable. So, are there any treatments for dementia?
We know that physical exercise slows the progression of particularly Alzheimer's disease, and that's walking, brisk walking, or perhaps swimming, or even cycling, dancing, for about 30 minutes 5 times a week. Physical exercise is very important. In terms of other medications, we know that there are symptomatic treatments for Alzheimer's disease, and your general practitioner or specialist will tell you about these. These medications do not affect the progress of the disease, but in a number of people they will help the symptoms. There are no treatments that can cure dementia at this present time.